Everybody either knows someone who has knee pain or has knee pain themselves. I've seen many patients who have knee pain to the point of needing a knee replacement, and let me just say, it's not fun. The surgery is painful, the recovery is painful, you do not want to have one. Even if you're already having a lot of pain in the knee, we can always prevent things from getting worse. With that said, let's talk about some of the things that we can do to help our knees last forever. Everybody likes to say that wear and tear is the primary cause of knee pain as we age. Now the issue with that is I've seen plenty of people who were very active when they were young and now they have a lot of knee pain. But I've also seen people who have done nothing in terms of physical activity throughout most of their life, and they also have a lot of knee pain. So in the case of the first group, it's probably more so poor mechanics when doing the activity due to several different factors that we'll get into in a second. In the case of the people who never do anything physical, this is more so use it or lose it. Everybody knows that if you go to the gym, you get stronger, muscles get bigger, and then if you stop going to the gym, your muscles will then decrease in size and strength. Now this is similar for the cartilage within your joints. The cartilage needs some form of stimulation, typically in the form of weight bearing. Now without this stimulation, your body will actually get rid of this cartilage because it's not needed, because it only keeps what it thinks it needs. And if you're not using it, it deems it unnecessary. Now in terms of mechanical issues with the knee and things that you can help fix right now, the first thing to look for is hip abduction weakness. So one of the glute muscles, called the gluteus medius, serves to stabilize the knee in a side-to-side motion. If this is weak, what we'll typically see is the knees moving towards each other with any sort of dynamic activity, such as running, jumping, squatting, or even standing up. This affects how the kneecap moves. So typically it should be more or less straight vertical up and down, but when you have this valgus and the knees go in, the kneecap is pulled out. Activity with the knee in this compromised position will cause the cartilage around the kneecap to degrade. Or any sort of band walking or abduction activity of the hip will strengthen the gluteus medius. You'll want to make sure when you do this that you're not bending the hips forward too far, because then you might be biasing a different muscle that we don't necessarily need to strengthen. The second thing we can look at is hip rotation mobility. So in everyday life, whenever you're twisting or turning, you're typically twisting on the hips. Now if your hip is tight and it won't let you twist, the twisting motion is transferred to the knee, which tries to compensate for the lack of mobility at the hip. Now what this leads to is a little bit of a shearing force as the femur and the tibia twist on each other. That's not very good for your knee either. There are several stretches you can do to fix this. You'll want to stretch out the piriformis muscle, as well as the other external rotators of the hip, as well as the internal rotators, because whenever one hip is externally rotating as we twist, the other hip is doing the opposite in internal rotation. Another thing that causes pain in the knee is tightness of the ankle, specifically the motion of dorsiflexion. Now whenever you're squatting, standing up, or even using stairs, if your ankle is tight in this motion, your body will tend to compensate by pronating the foot, meaning that your foot will roll in and this will collapse the arch. What this does is it actually pulls the knees in that same valgus position that we talked about earlier, which again damages the knee. Now what you'll want to do to fix this is stretch the calf with the knee in a bent position. The reason being that this stretches the soleus muscle, which is often the culprit. Now you should feel a stretch in the calf muscle itself. If you do not feel it in the calf, you likely feel it in the ankle, which is fine. It means you're just stretching the joint capsule instead of the muscle, which is also restricting your mobility. A tight ankle isn't the only thing that causes pronation, where the foot will roll in and flatten out the arch. Weak muscles in the foot can also cause issues here. What you can do to help is try spreading and pulling the toes together to strengthen all the muscles within the foot, as well as to try and lift up the arch of the foot by activating your muscles. You'll also want to strengthen your tibialis posterior muscle, as this has a tendon that connects underneath the arch and helps to support it. Now if you're young and you have a more or less healthy foot, I would recommend not wearing shoes that have much arch support. The reason being that using a shoe with arch support over time will weaken the foot and the muscles that are supposed to support the arch in the first place. Imagine you wore a back brace every day of your life and then you took it off eventually. How bad would your back feel? I'm guessing you'd be in a lot of pain. In a similar way, if you're wearing a shoe that has a lot of support, it means the muscles of the foot don't really have to do anything to support the arch. Now, when you take the shoe off, you feel this. People develop issues such as plantar fasciitis because of this problem. Now, if you're older and you do have some issues with your feet, you can't just go from wearing a shoe that has a lot of support to a shoe that has no support. This will feel like taking off the back brace. You're going to have a lot of pain if you do that. You can try to strengthen all of the muscles within the foot, as this will help to support the arch. And if you want, you can try and progressively wear a shoe with less and less arch support and see how that goes. But your best bet would be to strengthen the muscles of the foot. The final thing we're going to talk about is the strength of the muscles surrounding the knee itself. So we have the quadriceps, hamstrings, and then your calf muscle. Typically, people have fairly strong quads. It's more so the hamstrings and the calves that are weaker. Throughout everyday life, people are always using their quads when they're walking or standing up, less so the hamstring and the calf. Now, obviously, we want to strengthen all three of the muscles. We can't overlook any of them, but for most people, I would start with the hamstring and the calf, assuming the quad is strong. Now, as with anything worth doing, it can take a long time before you see any actual results. Knee pain is almost always degenerative in nature, typically due to the mechanics that we talked about, and it can take a long time to fix the muscular or flexibility issues that are causing the knee pain in the first place. So have patience and be disciplined in what you do. If you stick with it, it'll help you long term, and hopefully this will help you avoid any sort of major surgeries later in life.